Good afternoon, everyone. It's Susie Reddick here from the Philadelphia Department of Public Health, and I'm joined with my coworker, Anita Wade. She's an epidemiologist with our program. One favor, could somebody type in the chat box that they can hear us okay? We just want to make sure that everybody is able to hear us. And I'm going to wait for that to come through.
Great.
Okay, that did come through. Okay. Like I said, chat, you can type in if anything's going wrong and you're having a problem with hearing us. So Anita and I today are going to talk about easy-to-use tools for displaying hand hygiene and outbreak surveillance data. I'm a nurse at the Public Health Department and an infection preventionist, and as I mentioned, Anita is one of our epidemiologists. Speaker disclosure, Susie and Anita, we have nothing to disclose. Little housekeeping, all participants have been muted during the presentation. Please type any questions in the group chat box during the presentation. Time permitting, there will be a Q&A session at the end. I'm sure we're going to have some time for questions. This presentation is being recorded and will be shared on our website, and we have here the link for the website. Objectives. Anita and I would like to give you a brief overview of the importance of infection control surveillance, a tutorial on how to use the Philadelphia Department of Public Health's Microsoft Excel tools to track hand hygiene observations and outbreaks in your facility. We want to show you tools to graphically display your data to share with staff and partners, and show you some examples of using your data to support your process improvement efforts. I'm hearing a few more people joining us. This is Susie Reddick here at the Health Department with my coworker, Anita Wade. We just basically went through some housekeeping, that you're on mute, type in any questions in the chat box, and we went through the objectives. I don't think you missed a whole lot, so we're going to get started here. I wanted to mention that a lot of you know that the Health Department, we've been out to visit you on what we call an ICAR visit. An ICAR is Infection Control Assessment and Response. And we learned a few things about infection control surveillance when we went on these visits. We learned that while the IPs conduct hand hygiene observations, they're not always documenting those observations. Feedback for hand hygiene compliance is given, but it's not always documented. Data are reported at your monthly meetings, whether it's your infection prevention and control meeting, a QAPI meeting, but it's not displayed and trended over time. So you're not graphically displaying it and then looking to see if you've gotten better or even worse over time. And then outbreak data are not plotted on an epi curve. Next slide. So briefly, what is surveillance? So this is the APIC surveillance definition, APIC being the Association of Professionals in Infection Control. It's the ongoing, systematic collection, analysis, interpretation, and dissemination of data to identify infections and infection risks, to try to reduce morbidity and mortality, and to improve health. Your surveillance plan is going to be the core activity of your IPC program, and it's also a regulatory requirement. Purpose of surveillance is to identify infections and outbreaks, monitor trends in infections and pathogens. So it might behoove you to think about how much CRE do I have in my facility. You want to know your baseline, and then once you know that, you would know if you're seeing an uptick in the organism in your facility. Monitor staff adherence to IPC practices, identify performance improvement opportunities. So with those two, I think about the biggie is, of course, your hand hygiene and then your PPE use. And then track progress toward priorities identified on the annual facility IPC risk assessment. And just a little review of process and outcome surveillance measures. So your process surveillance measures, this is where you audit practice with direct observation or review of documentation. So you're reviewing or auditing the adherence to your practices, and this can drive your process improvement efforts. Once again, examples here with direct observation would be your hand hygiene compliance and your PPE use compliance. Review of documentation, an example there could be looking at antibiotic use. You might review your charts for a bunch of your patients to see that they were correctly prescribed antibiotics. And then your outcome surveillance measures, this is where you identify infection events. So this is where you're actually looking at like the outcome of the care that's been provided to your residents. And there you might say, look at influenza case counts or norovirus case counts. You might look at the number of cases, or you might calculate a rate of infection. So looking at data collection tools for detecting an outbreak, you know, what you have is your 24-hour report where information is collected on residents to see how they're doing over 24 hours, anything new, and you might start to notice, hey, we're seeing a lot of people with new URI symptoms, influenza-like illness symptoms, or maybe new GI symptoms. So from your 24-hour report, you will start then a line list for targeted infections. And the next slide gives you an example of a line list. You want your line list to show demographics. It could be also for staff if they're getting sick, location, signs and symptoms, your diagnostics, which would be your lab results. It could be x-ray, treatment if it's prescribed, and then the outcome. You want to use a standardized tool for your line list. And we have a link at the bottom of this slide, which does show an outbreak tracking sheet that we have available on our website. So how would you display your outbreak when you're presenting this data, say at your committee meetings? You might just describe it with a little summary like this. It says influenza outbreak on the 4 South unit. It started on February 18th. It ended on March 2nd. There were 15 cases. And then you'd list your interventions. You know, did you start Tamiflu? Did you put the whole unit on droplet precautions, increased environmental cleaning? But you could also do what we're going to show you in the next slide, which is an epidemic curve for an outbreak. And an epidemic curve, it's going to display the number of cases of illness by the date of illness onset. I'm hearing some new folks joining us. We're just doing a little review of surveillance. And right now we're talking about an epidemic curve for an outbreak and what that gives us. So like I said, it displays the number of cases of illness by the date of the illness onset. So it's going to show your distribution of cases over time. And it'll give you a sense of the magnitude of your outbreak. You can also use it to estimate the disease/incubation period. And once you do that, you might be able to identify what's causing the outbreak. And the way we display this data is with a histogram, and this will show our frequency distribution. So basically, it's showing you the number of cases over a period of time. And this is an example of a histogram. Anita's going to go into this in more detail, but you see your vertical axis, sorry about that, is giving you your number of cases. Your horizontal axis is giving you the date that they occurred. The blue is influenza-like illness. The green is laboratory confirmed. And then you see there's that little orange box. And if you click on that, you will be able to see what intervention you instituted. So it might help you figure out what worked, what didn't work. Like I said, Anita's going to explain this in more greater detail and actually what tools to fill out so that you can then get this curve and show it to your other staff. So we're going to just mention real quickly here data collection tools for hand hygiene compliance. Many of you were at our collaborative. This was the tool that we showed everybody, and some of you are already using it. This was created by some of my coworkers in our program here. There's other tools that we presented at the collaborative, but this seemed to be the one that most of the folks liked. So this is just a hand hygiene and PPE observation sheet. And Anita's going to also go through with you how to fill that out. And I mean, you know how to fill it out, but she's going to go through like, what do you do once you fill it out with that data? So you can create some nice data tools to show your staff. And Anita's going to take it from here, talking about how to use our data collection tools.
Thanks, Susie. As Susie mentioned, my name is Anita Wade, and I'm an epidemiologist with the Philly Health Department. And we've developed 3 different Excel tools that we're hoping will be useful out in the field to collect information like Susie discussed. So I'm going to go over those. Once again, I want to mention that the chat box is available. If you have any questions, if something seems unclear, please feel free to just type a note in there and let us know, and we can slow down and go over it in more detail. But as Susie already showed, this is an example of a hand hygiene observation sheet. And it has one row used per staff member and hand hygiene opportunity. So you can cover both hand hygiene observations or PPE observations, so personal protective equipment observations. For this presentation, we're only going to be talking about hand hygiene observations, but just know that it is available to look at PPE as well. This is an example of a filled-in sheet. As you can see, you just can write the staff type, what kind of hand hygiene opportunity it was, whether it was room entry or room exit, and what kind of hand hygiene was performed. And then, once again, you can go into the PPE use as well. Now, as Susie mentioned, we also developed a second type of hand hygiene observation tools, and this allows you to fill out multiple observations for the same staff member. So you could put the date, the staff type, and then use tally marks or check marks to denote successful hand hygiene opportunities and 0 with a slash through it for unsuccessful opportunities. So you can just mark for the same staff type, you could get multiple observations instead of using one row for each. And then at the bottom, it includes a place for tallying up the column totals so that you know exactly how many, by each opportunity type, how many times hand hygiene was performed or was not performed. And someone just sent a message, will the slideshow be available after the presentation? Yes, it will. We will send this out and all the tools, and they will also be available online. So we'll send out a note once they're up on our website so that you can access them. So now I'm going to go into the Excel tool for entering this data. Oh, I'm sorry, this slide is out of order. This is just an example showing if you were using the form that, as Susie mentioned, from our collaborative, most people were most familiar with and most comfortable with, you could just create there's many different ways to do this, but you could create a simple tally sheet on the side of the paper, however you would like to do it, and just track how many times room entry hand hygiene was performed. So for this example, it was 3 times room entry alcohol rub, room entry alcohol rub, room entry hand wash, and then how many times hand hygiene opportunities were missed. And that would be a really quick and simple way to kind of tally up whatever information you've collected on your sheet. And for the hand hygiene, the other sheet, as we already went over, it already kind of tallies it up for you at the bottom. So you can count the total number of hand hygiene successes observed by opportunity type, and you will enter that in the hand hygiene data tool, which we'll show next. And you could count the total number of failed hand hygiene observations by opportunity type and also enter those in the tool. So getting into the tool, which we hope looks not too overwhelming to you, we're going to break this down into smaller pieces. So this is a screenshot of the Excel file, and after I go through this, we're going to actually open it up so you can see how it works. There are, on the left side of the sheet, each unit observations are entered in a separate table. So we included enough space for up to 15 units to be entered. We heard that that was roughly the max number that one facility in Philadelphia had, so we just kind of made 15 as a rough ballpark. But you can use as many of them as you want, or you could just use one of them and use it for your whole facility. And then on the right-hand side of the sheet, it includes a summary table. And the summary table is auto-populated for the whole facility by opportunity type, this first one. And then a summary table is auto-populated for the whole facility by unit. So we created these tables so that you could easily compare either unit-to-unit comparisons, or just if you wanted to look at the whole facility and see how is everyone doing with washing their hands before entering a room or when they exit a room, you could use this top table to kind of get at that information. Now at the bottom of the form, there's a navigation bar that allows you to go between all the different tabs. And we're just going to cover the first tab, which is entering data by opportunity type, which is what we've been looking at previously. So this is just a blown up picture of one of those unit tables. Again, there are up to 15 of them. And the yellow boxes denote that you should enter data in them. If it's yellow, it means feel free to enter data in them. If it's white, it has most likely been locked by us so that formulas can't be changed accidentally. So you'll enter data in the yellow boxes that you collect from those hand hygiene observation sheets. So for example, for Unit 1 North, which you can enter the unit name up here, there were 13 times that hand hygiene was performed and 2 times that it was not performed. The total number of observations will auto-populate, so you know that you made 15 observations based on room entry. And the compliance rate will also auto-populate. Now, just a note, this divide by 0 error message will show up whenever there were 0 observations made for that opportunity type. So you can just ignore it. It's a common message that won't mess anything up. And as you can see, these compliance rates are color-coded. And I'm going to go through how you can do that. But we set up a few benchmark color code ranges for what we kind of considered like bad, average, and really great in terms of compliance rate, what your facility may be working towards, that you can actually change, that you can quickly kind of visualize how these rates compare. So as I mentioned, you can fill in separate tables for each unit, or you could fill in one table for the whole facility, really whatever suits your needs best. And then the automatic summary table is created. So using these 2 example tables, it automatically pulls all that data together and gives you the average compliance rate for room entry across the whole facility, or the average compliance rate for before glove. And as I mentioned, these are the current benchmarks that we included, just kind of saying that red was below 70%, yellow 70 to 89%, and green was 90 to 100%. But when I pull up the example, I'll show you that you can change these to be whatever your facility sees. If 90 to 100 seems really, really a lofty goal and you would like to maybe make it 80 to 100, you can do that so that it fits what you're seeing and kind of encourages your practices in your facility to improve. And once again, this is a close-up of the second summary table that is created for the whole facility by unit. So you can easily compare example 1 North and example 1 South against each other and kind of see how they're doing and that they're relatively close in compliance rate for this example. So now I'm going to pause and switch to the Excel file just to kind of go over what we just discussed. So just bear with me for 1 second. Okay, so as I mentioned, this is the Excel file. You have 15 units on your left-hand side and your 2 summary tables on your right. And it's really pretty simple. All you have to do is put in your unit. For this, we'll just say 1 North again. And then from your observation sheets where you've already calculated the total number of room entry times that hand hygiene was performed and the total times that it was not performed, you can just enter that directly in the form. So I'm just going to enter some example data so you can see how it will change. Please disregard what numbers I'm putting in which categories. This is just an example. But as you can see right away, my fake facility isn't doing too hot, but right away the numbers will change depending on what you put in these yellow boxes, and it will automatically populate the total on summary table on your right-hand side, and it will also fill out that example unit 1, so that if I had data here, it would also automatically populate. Let me name this 2 South. And now, as I mentioned, if, like I said, my facility looks like it's not doing very well, most of it's in the red, I could change these benchmark ranges by just simply clicking on the box and saying, let's make this 80 to 100, maybe 79 to 60, and 0 to 59%. And you can see how some of these boxes have already changed colors to match whatever that benchmark is. So that's just one way that you can kind of visualize your data quickly and just kind of see where you're standing in comparison with your units to each other and also in comparison of opportunity types to each other. So now we're going to go back to the PowerPoint, so hold on 1 second. And once again, if I go through anything too fast, please just let me know and I can slow down. But now we're also going to go through the second tab on this toolkit, which is entering data by staff type. So we kind of put our heads together and decided that opportunity type may be something that your facility is really interested in, but they may also be interested in looking at staff type and seeing if there's certain staff that really need, maybe could use another lesson in hand hygiene and proper hand hygiene techniques. So this figure looks exactly like the figure, the Excel sheet for opportunity type. You'll notice the only difference is that it allows you to look at staff type instead of opportunity type. So we put MD, DOs, PAs, different kinds of nurses, rehab, diet, rehab being like respiratory or occupational therapy or physical therapy, environmental services, social workers, whatever you would like. And I go through, if maybe these staff types don't fit your facility, you can change these headings, which I meant to mention for the opportunity type as well, that those headings are adjustable. I include instructions in the spreadsheet on how you can go about doing that. But just to pull that up in Excel so you can see it, it's right down here, data entry by staff type, and it looks very, very similar and works the same exact way as the other one, where you can change your benchmark ranges and you can just directly enter your unit number and the number of observations you're getting for each staff type right in the field and have it change automatically and fill out the summary sheets. So we also, besides having a place for you to enter the data, we discussed how it would be really useful to have a way to visualize the data, to graph it, as Susie was discussing previously, that you could bring to different program meetings or use just for your own needs to kind of trend this data over time. So the graphs are auto-generated, and they're in these second two tabs, which are graphs by opportunity type and graphs by staff type. And someone just asked, can we modify the hand hygiene opportunities to fit our facility? And yes, you can. I'm not sure, sorry if you asked that before or after, but yes, you can adjust these titles. So right here for this example, room entry, right, room exit, to whatever is the correct policies for your facility. But this is what the graphs will look like when you have no data in your tables. So if you open up your spreadsheet and you pull this page up and this is what you see, and you're worried, this is right, so don't be worried. This is what you should see if there's no data in any of the tables. If you do have data in the tables, this is the graph that will be created. So we have bars representing the number of observations. Blue signifies hand hygiene was performed, and red signifies that it was not, so that you can compare, first of all, how many observations you're making for each opportunity type, and also what is the proportion of times that it was successfully performed and unsuccessfully performed. And then this is the summary graph. So you'll also get a summary graph. So you'll have one graph for every unit and one graph for the whole facility showing this information. And I'll just pull that up in Excel so you can see what that looks like. So we'll use our same two example. I'll put a few more cases in here just so there's a little bit more in the more bars. Okay, and so you would just come to this second tab, which is graphs by opportunity, or this second to last tab, graphs by opportunity type, and automatically the graph will be populated and it shows you which unit you're looking at, and then also has the graphs for the whole facility over here on the left. And it would do the same thing. We didn't have a lot of data in our staff type graph, but you'll get graphs by staff type as well. And once again, if you change the names here, it will automatically update the names on your x-axis as well. So we're going to go back to the PowerPoint. Sorry for all the back and forth, but we thought it would be really useful, instead of just seeing screenshots, to actually be able to see what the tool looks like in reality. But we found that it's really useful to be able to track this data for 1 month, which is what those tool sheets would do, but that it'd also be really great to be able to track this data over time. So we created a separate Excel file that can kind of be like a master sheet or almost a journal, where you can put all of the data that you have been collecting over many months in one place, so that you have it to kind of look at and use to inform practice. Are we getting better? Are we getting worse? Are we staying the same? Which, whatever fits your needs. So we're going to go over that. So this is a screenshot of the hand hygiene master sheet. It's a separate Excel file, as I mentioned, and it's used to track hand hygiene compliance rates over time. It includes this table at the top, which we just tracked it by unit. I did not include a separate tab to kind of track each opportunity type. This would be tracking just Unit 1's average compliance rate versus Unit 2 versus Unit 3, and so forth over time. So just so that makes sense, if everyone has questions, feel free to ask. But it's just tracking the average for the unit and not each opportunity type over time. But to fill out this table, you would navigate to your hand hygiene sheet for whichever month you're using. So let's just say this is October's data sheet. I would copy that compliance rate column in the summary table. Show how I would right-click on my mouse and select copy, and then I would navigate to the hand hygiene master sheet file, place my cursor in the first cell of the month of data. So for this example, it's October, and hit paste values. Hitting paste values is really important because it makes sure that the data you're entering is actually the data that was in that first file. Otherwise, it will try and calculate a percentage based on this table. But all that's just to say, make sure that you hit paste values, which is this, for this version of Excel, was a 1, 2, 3 icon when you're pasting into this tab. And so this is an example of a few months of data. And I just want to comment, when you see this, once again, you see this divide by 0, that's because for this facility, we only had 2 units, Unit 1 South and 1 North. So you can actually come through and you can just delete these values that are in these boxes. And this is the graph that would be created if you had entered several months of data. So you have your hand hygiene compliance rate for the facility from October 19 to February 20th. We also wanted to give you a few different ways to look at this. So this is the average for the facility, but we also have it so you can compare units to one another. And we did this in 2 different ways. You could either look at it by bars, or you could look at it by lines. This is the same exact information, just shown 2 different ways. As Susie and I were kind of looking at this information, she really liked the bars and I really liked the lines, so we decided to just give you both, because you can decide for yourself which ones you guys like. But to show you this form in Excel, it's right here. The first page includes step-by-step instructions, just like I went over, for how to copy and paste it into this form. But you have your form that would include your hand hygiene compliance rate and a graph for the facility, and then by unit with bars and by unit with a line graph. So I'm looking at the time just to see if do you think we have time? Okay. And I'll just quickly show you how to do that. So if I opened up my hand hygiene toolkit, so let's just say this is the month of data that I want to enter into that spreadsheet, I would navigate to the compliance rate column, put my mouse in the first column, and drag down, right-click, hit copy, and then navigate back to that hand hygiene master sheet put my mouse in the first cell, right-click again, and this time the icon looks a little different because this is a newer version of Excel than I have on my computer, but it's just right there, paste values. So there's my values. And I can also type in I can either copy or type in my unit names so that they're present as well. So I'm just going to copy. So I'll copy this again. You just put your mouse in the first box, drag down, right-click, copy, then come over to your master sheet, put it in the first box, and paste. And I'm going to delete these zeros because I don't have units named 0. And I'm also going to highlight and delete these divide by 0 error messages. So since I don't have several months of data, I'll just put in a few example data sources so you can see how the graph will change over time. And once again, please disregard if these numbers, how they make sense in comparison to one another. But okay, so there's a few examples of data, and because I did not copy the total, this will be automatically done for you when you copy and paste, so you won't have to worry about writing formulas, but just for this example. So as you can see, here's our hand hygiene rate for the facility tracked over time, and then we also have the units in comparison to one another, and then a line graph of the units in comparison to one another. You'll see that you're going to get squares because it includes space for up to 15 units. We didn't want to go over exactly how you can modify this. If you maybe have some skill in Excel on your own, you can change the data that the graph is pulling from. But just know that it will label the units that you have. And if you have any questions, you can reach out to us and we can kind of help you through it. But it will label, so I only have 2 units, so it's just going to show those 2 columns. Okay, so we're almost there. As Susie mentioned, we also wanted to talk about tracking outbreaks in your facility. So we created an influenza-like illness data entry table that will create that epidemic curve that Susie showed earlier. So this is an example of the blank spreadsheet for tracking influenza-like illness, which you can either use by unit or for the whole facility. We only created one table, and you can either download multiple copies if you want to track multiple units, or if you are tracking multiple outbreaks, you could also just download multiple sheets. But we just created one table for this. You can change the column titles to adjust for other conditions. So perhaps you want to look at norovirus or some other infectious condition that is an outbreak in your facility. You can change these titles to match that. And this is an example of a filled-in surveillance sheet. So we have its example 1 north, the date of onset, the first day that we got a laboratory-confirmed case of influenza, and we immediately instituted droplet precautions. So I'm going to go through this intervention instituted column. After we discussed that, you would enter the date, you'd enter the total number of laboratory-confirmed cases, and the number of influenza-like illness cases that were perhaps not laboratory confirmed. And then you can describe any intervention instituted on the day that it was instituted. And if you institute it, for example, on day 4, you instituted initiating active surveillance, you're going to enter a 1. So you're just going to enter a 1 if an intervention was instituted. Otherwise, you leave it blank. So that's all you have to do for this column. Anytime that we instituted an intervention, you will enter a 1. Even if you started multiple interventions in one day, like let's say 3 of these happened all on day 3 or 4, you would still just put a 1. And I'll go over why that is in a second. So the toolkit is going to automatically create the figure below. You'll have the number of influenza-like illness cases, and then also the number of laboratory confirmed, and then that little orange box that Susie discussed, which is intervention instituted. So you can see clearly this helps you kind of track what's happening in the outbreak in your facility, and it will automatically populate so that you can quickly bring this with you to a meeting to discuss kind of what's going on and what the counts have been for infection in your facility. As I mentioned, the box indicates an intervention was instituted. It doesn't tell you what that intervention was, but it kind of serves as a placeholder or a reminder for you to go back, and you can look at that first sheet and kind of see what was happening on that day, how did these interventions kind of affect what that outbreak curve, how that outbreak curve looks. So this is an example. We're going to go into the Excel sheet so you can see what it looks like. So here is our surveillance sheet. Make it a little bit bigger. And we can enter, once again, we're looking at 1 North as our unit. And this is a little different than the screenshot we just showed you. But all you have to do is enter the first date that this case began. So we'll say that this began 12/1/2019, and all the subsequent dates will automatically populate to make it kind of easier on you so you don't have to go through and type a bunch of dates. They'll all autofill. You just have to write in that first date. So perhaps on the first day we didn't have any laboratory confirmed cases, but we had one person show up with an influenza-like illness. Day 2, maybe there's 1 laboratory confirmed case and 3 people getting sick. This is a really bad season. In this example, just fill out a few cases so that there's some data on the graph to look at. And there we go. And if we started interventions right away, we could fill those out over here. And we would just enter a 1. And maybe another example of an intervention.
Increased surveillance.
Yeah. And we'd have another 1. So you can enter all your data, and then automatically you're going to have this figure pop up that will show you the number of influenza-like illness, the number of laboratory confirmed cases, and then whether or not an intervention was instituted on which day. I'm going to bring up the PowerPoint again. And now I'm going to turn it back to Susie to kind of talk about, we talked about how to get this data, now she's going to discuss what do you do with it once you have it.
Okay. So you want to turn your data into action. So you leverage technology to support infection prevention and apply basic statistical analysis. So hopefully that's what Anita showed you with using the Excel spreadsheets. And then once you have that, you can interpret your data to inform your infection prevention practices. And lastly, we want you to build confidence in sharing and explaining your data to others. So interpret and use the data. It will inform your IPC program activities, identify practice improvement needs, and monitor compliance over time to establish your baseline. You want to share your data with your stakeholders, your facility leadership, your frontline staff, your IPC and QAPI committee meetings, and even think about sharing it with residents and families. And next steps is really think about documenting all your hand hygiene observations. You know, even the ones where you walk down the hall and you give some feedback because you know this hand hygiene wasn't performed, or maybe it was performed and you want to give kudos to somebody. You know, just carry that sheet around with you on your clipboard when you're making your rounds and collect all those observations. Next, I think some of this could be overwhelming, especially, I know, like for me, I'm an older person. I didn't grow up with all of this computer technology, but you really just have to play with these tools. And I think you would really like the results. You know, maybe don't start doing whole house. Pick one unit that you're going to display their hand hygiene data, or do your whole house, and then see what that looks like. So you need to use the tools that Anita showed you, and then display your data at your meetings. And think about signing up for our long-term care working group by emailing us at this email here. Now, we mentioned this at the collaborative. We're still working on a meeting date where you guys could call in, and we're thinking in the new year, maybe sometime in January. We're thinking of sending out a doodle poll and getting an idea on what days and times work best for everybody, and we'll try to come up with a consensus on what works best. So conclusion, what Anita and I reviewed with you, I will say mostly, I think Anita had the hard work with this presentation, putting together all of these slides with the Excel spreadsheets, is the importance of surveillance. We showed you 3 separate Excel tools. One was hand hygiene observations for a month, by opportunity type and staff type, by unit and whole facility. We showed you how to track hand hygiene observations over time using bar graphs and line graphs, and then tracking an outbreak in your facility using an epidemic curve. And what's new at our health department? Please check out our new website for resources, presentation slides, reporting guidance, and more. This is where we'll have the slides from today's presentation, and we have some other information on there about antimicrobial resistance, and we might have some other tools for you that would be useful. And it's now time to take questions. Do we have any questions from the group? I think Anita, do you see some there?
These are ones we already covered, but I'm going to unmute everyone. So if you could, we'll test this out, and if it doesn't work, I can mute everyone again. But I'm going to unmute everyone, so please mute yourselves if you don't have a question. But if you have a question, feel free now to bring it up to the group or type it in. Maybe we'll just unmute. I mean mute. We'll have everyone mute, but you can actually unmute yourself. If you click on the on wherever you see your name, you can just hit unmute and ask a question if you have one, or if you would like to see any of the tools again, we can pull those up as well.
Hello, can you send out the website again that had the link that it was in the last slide?
Sure. Yeah, this one?
Yes.
Okay.
Yeah.
Is that the one where you're going to have all of these tools, right?
It will, yeah, they'll be under the resource library.
Okay. All right, thank you. I'm sorry, our other phone is ringing.
Oh, no problem.
No problem. Okay. Any other questions from anybody?
Or comments?
Yeah, comments? Anybody want to give us any feedback on the tools? What you think? Okay.
Well, Susie and the HAI-AR program's website are right here. If you think of questions later on, feel free to reach out to us. And we will, I believe we can send out an email once all of this, it's not currently up on our website yet, but once we get it up there, we will send it out to everyone so you guys have it. And we'd love feedback to hear how it can be useful to you, or maybe how it needs to be improved so it is more useful to you.
All right, so stay tuned for, we'll be sending out an email or we'll be, for the doodle poll, and hopefully we'll be able to have a call with folks in the new year. That's our goal.
That sounds good. And we'll try and email them out to you hopefully by the end of the week, so you have them. But thanks so much for joining.
Yeah, thanks everyone. Happy holidays.
Yeah. Bye.
Bye.